Oh. 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 Oh my gosh. That was the loudest that we've ever done so far with the mic drop.
Really? So I'm excited to have Melanie here today, or I call her Mel sometimes, because this is her third visit. And she's been to my office. We didn't shoot any YouTube videos. She just came in as a regular patient. And one of the chief complaints was migraines, right?
Yeah, really bad.
I mean, she has tight neck, traps, and I guess we started about 3 weeks ago, right?
Yes.
So this will be the third visit?
The third
visit, right.
Mm-hmm.
Tell us a little of the history of the migraines. You're someone who was used to get them how often?
Anywhere between 4 to 6 times a week. I work from home, and so my posture was like bad, but also like everything just feels super tight, and like I would get nausea and sometimes vomit because it was so intense.
Right. Was it more one-sided, like where the headache's on one side of the head, or both sides?
Usually both sides, and like I would feel it in my eyes because like it was so intense. So I was really sensitive to lights as well.
That was my next question. So we call that photosensitivity or light sensitivity. And when your migraine is really bad, for some people, we want the lights off. They have to almost be in darkness, right?
Yeah.
So how many days a week do you think you'd get the migraines overall before?
Before, 4 to 6 times a week.
4 to 6 migraines a week.
Yeah.
And how many years back has that been?
I would say ever since I started like this job, so about 4 years.
4 years of massive headaches. Okay. Do you have a headache right now?
I haven't had coffee, so a little bit.
Okay.
But
so coffee helps.
Coffee helps.
All right, good. Good to know. Everybody's got their tricks. And so after the first visit, how much better were the migraines?
Oh my gosh, everything got so much better. I would say since I started visiting you, anywhere between 1 to 3 max, but between 1 and 2 for the past 2 weeks.
Okay, so the first week was about half as frequent.
Yes.
And then even now it's even
like
better
1
than
or
that.
2, yeah,
okay.
for sure.
So this will be the third treatment. I'm going to have you sit down, and we're going to start where we left off, which you haven't seen yet, of course, because this is the first one we're videotaping. But sit here, and you can face her. And what I'm doing is I'm feeling that occiput, because a lot of the headaches she was getting, I felt that the top bones, here look at my neck, these top bones were all cramped up on her. And especially, always felt like the left was worse too. Do you feel this one?
Mm-hmm. Yeah.
They're both tight, but the left is worse.
Yes. Oof, that's sensitive.
Yeah. Can you reach under the stool and find the handle? Do you feel it? And if you do, lower the chair.
I think it's low.
It's low as can
Yeah.
go. Okay, thank you. So I'm going to adjust that.
Oh.
Drop the head this way. Drop it.
Oh.
It went, but it didn't make a loud noise. Did you hear it crack?
I heard it crack, yeah, for sure.
I want to get more out of that. You're going to lie on your back next.
Oh.
How was that spot?
It was a relief. Good relief.
So when we were in the chair, it popped. You could hear it, but it was kind of, it almost felt like a ricochet in her head, and it didn't come out. Because I could feel it move, and I could hear it go, but it didn't make a dunk noise.
Yeah.
This one is going to be there today, I think, too.
Oh. Oh, man. Ooh. That was good.
That was good, right?
Mm-hmm. Yep.
Big breath in and blow it out. Now, migraines can be for different reasons. Migraines could be hormonal. Migraines could be sensitivity to different foods. There's also a lot of mystery migraines. People don't know why they get migraines. High blood pressure can affect migraines. Menstrual cycles can affect migraines. There's so many different things that could be a player and part of someone having chronic migraines. Misalignments can be a part of it. Not for every case, but I kind of felt hers was for two reasons. One is that she didn't have them her whole life. I don't have to say her age, but it's not like you said, oh, I got it since I was 12 years old, and that was the way I grew up, was always having migraines, and every time I get my menstrual cycle, I had migraines. So that was not her case. Did you notice she said when she started at her job, right?
Yeah. Mm-hmm.
So to me, that's more mechanical or stress.
Yeah.
So stress and mechanical. Mechanical means like the way she's at her desk, the way she's typing, the way she's monitor.
Yeah.
Did you change your monitor?
Yeah, I bought a 20-inch monitor, so now I'm facing straight versus down on my laptop.
Yeah, and that's something we talked about.
Yeah.
So I really wanted her to get out of her laptop and mirror a monitor straight up so she's not cramped down. So mechanically, we're taking some pressure off of her. And a couple of alignments, we're going to be consistent with it for a little bit longer. Mm-hmm. Excuse me, and try to make a change. And she's young, she'll respond. But it's not like I have to fix her hormonal balance or her blood pressure to do this. I'm working mechanically, I'm working stress, and I'm working on ergonomics of where the computer monitor will be so that she doesn't have pressure on her neck all the time. Yeah. So now lie face down. So now I'm up in here, and she gets fiery, tight muscles here. Do you feel that one, Mel?
Yes.
Oh, it just cracked just by me wiggling it. All right, so big breath in and blow it out. Big breath in and blow it out.
Oh my gosh.
Wow. Turn your head this way. How was that?
That was intense, but good.
Good. Big breath in and blow it out.
Oh.
Turn on your back. We're going to do the Y strap today. And we already got some stuff out of your neck, but let's see what is left, okay?
Yeah.
You tell me. So after I adjust, you tell us where you felt it, okay? So now, big breath in. And blow it out. Good. Pull your chin face down, face mask down just a little bit. Just the face mask. Good.
Oh.
And now tilt your chin back a little bit again. There you go. Big breath in and blow it out.
Oh my gosh. That was the loudest that we've ever done so far with the Y strap.
Really?
Yeah, because it was like my entire neck into like my mid back.
Everything went.
Yeah.
Did it pop or just separate?
What's the difference?
I don't know. Come back up. Sometimes people actually don't hear pops, but they feel like it go.
So then, yeah, it was like a little both.
A little of both. Scoot back down towards me one more time. I'm going to reach under you and get you a mid-back spot down here.
Oh.
What do you feel on that one?
Oh, that was a lot of pops.
Yeah, more, right?
Yeah.
Turn this way on your side. Hold the top knee up. And let me hold your hand. And bring this down. Oh. Got it.
Ooh.
Wow. Good one, right?
That was amazing. I can't even move now.
So bend the top knee up. Perfect. Good. So lie on your back. Let me have this ankle. Good. Come stand over here. How you doing?
I feel so much relief. I feel like the blood is flowing. Mm-hmm. I feel relaxed. So I feel so good.
So in the last 3 weeks that we've been working, overall, what percentage has your migraines improved?
I would say at least 90 to 95%.
Okay, that's awesome.
Like it's insane difference that I've ever had. So my favorite is always is it occipital lift?
Yeah.
That. It's always my favorite one because it's just like such a huge relief of the pressure that I feel like causes the migraines. Mm-hmm. Like it's like I feel it coming if it gets tight. And I remember you saying like as I come in it loosens and loosens more and more, and it's so true. Like I'm like so relieved right now.
Great.